Hi everyone, welcome to another webisode of The Good Doctor on EasyLiving.com. Today I'm here at the Humeira Badsha Medical Center, and with me is Dr. Humeira. Welcome to the show.
Thank you.
So Dr. Humeira, today's topic of conversation is about arthritis.
Right.
Now, for people who don't know what it is, can you explain what arthritis is?
So arthritis, very simply defined, is inflammation of a joint. But there are 100 types of arthritis. So there is the type which affects older people. Maybe your grandmother has it. Osteoarthritis, where they have a bad knee which needs to be replaced, or they have a bad hip which needs to be replaced. That's osteoarthritis. That's basically wear and tear, where the cartilage or the cushion between the bones gets worn out.
And that's what people associate arthritis with, is that we're getting older in age and therefore the bones will deteriorate and then I've got arthritis.
Right.
But like you said, there are various versions. Can young people get arthritis?
Definitely. You can get arthritis at any age. We have children, young as 1-year-old, 2-year-old, who get arthritis. That's juvenile arthritis. There's rheumatoid arthritis, which can affect you from any age right up to your 90s. And that can be a really destructive type of arthritis.
How do you get it?
It's an autoimmune disease. What that means is your immune system, which is supposed to protect your body from infection, turns against yourself. It attacks your own joints from inside. It's a very painful condition where multiple joints, it's not just one knee or hip like osteoarthritis. It's a very painful condition where multiple joints get swollen, inflamed, and you can be really disabled very fast.
So for our viewers, can you elaborate what arthritis in young age looks like?
Yes, so if you have rheumatoid arthritis, which is the most common type which affects younger people, you could have swollen, hot, inflamed joints affecting your wrists, your joints in the knuckles, in your fingers. They could be really swollen and inflamed. You can wake up in the morning with stiffness, being unable to move your joints and feeling like really pain. And this stiffness in the morning could last anywhere up to 1 hour or more even. And it can start slowly. It could start with, your left wrist. You think that you played tennis too hard, then goes to your right elbow. Oh yeah, my tennis game's not good. Then goes to your knee's swollen. You go to a doctor, then you do some tests. So you keep wondering. And then when you have multiple joints, the diagnosis may become apparent. So sometimes it takes a little while to get this diagnosed. So we want to diagnose people earlier and earlier, because then of course treatment is better and better.
So it's basically people experiencing joint aches with no reason.
Right.
And that can happen at any age.
Right.
And what happens to the bone? I mean, what role, or the cartilage, what role does...
Right. So the basic anatomy is we have bones which support our whole skeletal system. In between the bone, the areas where the bones joint is your joint basically. So you have the elbow, you have the shoulder, you have the wrist, fingers, etc. So there are 200 joints in the body. And every joint has cartilage, and cartilage is like the cushion between the bones, in the joint. But what actually is happening here, in that space, this fluid accumulates and it swells. So it's a swelling and inflammation. So it's not really the cartilage. So after some time of this being swollen or inflamed, it's like, think of it like acid in your joint, and it starts chewing into your cartilage and your bone, causing damage. So rheumatoid arthritis can be extremely destructive.
Is it genetic?
There definitely is a genetic predisposition, like everything, it's your genes. So there's a genetic predisposition to getting it. You may carry the gene, nobody in your family may have it at all, and then you may suddenly get this, and you'll be like, doctor, nobody in my family has it. My grandmother has a little osteoarthritis, why do I have rheumatoid? But there's also an environmental trigger, which we don't understand fully. There could be a virus which triggers it in your body. Your virus comes into your body thinks, oh my God, this body's under attack. It rushes to the defense. It's actually an overactive immune system, which is confused. It's attacking your own body. It's supposed to be there to protect you, but it attacks you.
So it could be genetic and it could be environmental.
Right.
What about food? Does that play a role?
Well, from the recent research, we don't have a lot of evidence that food plays a role. But more and more, we're looking at certain foods which could also play a role in making things worse. It doesn't cause the problem, but a lot of people are looking at gluten as an issue, or at milk, cow's milk products as an issue. If you already have arthritis, it could make the issue worse.
Right.
But the studies are still out there, so it's not really evidence-based yet.
Right.
But a lot of patients would go off these two foods, and then they would actually feel better.
All right, so that's basically arthritis. You can get it at any age. It's the inflammation between your bones, and the various factors that has an impact is genetics,
Right.
it's environmental, and to some degree, which sort of hasn't been proven yet, but I guess scientists think that the food has an effect on it, is the food that we consume. We're going to carry on this conversation. For our audience, would you like to pose a question that if they answer, they could win a prize?
Okay, let's make it really simple. At what age can you get arthritis?
Now, if you've paid attention, Dr. Humeira has actually answered this question throughout the video. Watch it and leave your answer below. Thanks everyone for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.